Good afternoon. My name is Eric Charles. Can you say your name for the record, please? Good afternoon, Eric. My name is Glenn Wage. And what is your candidate number, please? My candidate number is 2106024645. Thank you. And you are taking this test as a doctor, is that correct? Yes, correct. Thank you. Can I see your ID, please? Sure. The warm-up questions are not assessed as a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes. How do you handle upset patients who present you with a complaint? First, I give them the floor. I can't provide them with the right kind of assistance if I don't fully understand the issue, so active listening is key. Next, I rephrase their complaint so that I can confirm we are both on the same page regarding the problem. Then, I use empathy to ensure they know they are being heard, and that I'm concerned about their well-being, and what to find a solution. Finally, I take appropriate steps based on the nature of the complaint, becoming an active part of securing a solution. What is the most satisfying part of your job? I believe that the one-to-one contact that I can have with my patients, and their families constantly can enable me to do my best to them. It is always satisfying to hear that they have a very good experience with the services we provide in a hospital. And also I am very glad to be a part of that service. Are you comfortable working with other doctors and nurses? I find I work well under a variety of conditions and circumstances, and I take pride in my flexibility. I really enjoy working with a big team. I often find that different viewpoints can help me find solutions to a problem I might not think of on my own. I also enjoy self-motivating, and I am equally comfortable working alone. How have you dealt with conflict? I do my best to de-escalate the situation. If the conflict involves a patient's family members, I separate the parties by taking them out of the area. I then listen to both parties to find out about the issues and how they can be resolved. I will also escalate the problem to a senior staff member if necessary. How would your friends describe you? My friends would probably say that I am pleasant, but persistent. I make and keep friends easily, and I never give up. I know that if I try hard enough, I can achieve anything. Loyalty is one of my biggest qualities, and my friends would attest to that too. Great. Thank you very much for sharing that. So, let's move on to the role play. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions? No. You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about. You can make notes on the role play card if you want to. Here's a pencil for making notes. Thank you. You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. The role play will now last for about 5 minutes. Don't worry if I stop you when the time is up. Can you start the role play, please? Hi, my name is Rick Edward. I am your doctor for today. How may I address you? You can call me Glenn. All right, Mr. Glenn. May I know what brings you here today? Doctor, I found a wound on my ankle which is not healing well. Okay, let me examine it first. Oh, yes. Since how long have you been aware of it? I really don't know when exactly it started, but I noticed it fairly 2 months before. Oh, it has been so long. Anyhow, I appreciate the decision you took to reach our clinic with this. Before proceeding further, I would like to ask you some questions to get a detailed picture of your situation. Would that be okay? All right, you may proceed. Do you have a history of diseases such as hypertension or diabetes? Yes, I do. I have suffered from diabetes for many years. So, are you on insulin injection or tablets? I have been taking tablets since I was diagnosed 10 years ago. Moreover, I follow some dietary instructions given by my prior doctors. Alright, so, to reiterate what we have discussed so far, you are a diabetes patient for 10 years, and your blood sugar was under control with medications and diet. Am I right? Yes, you are right, doctor. I would like to know whether you track your diabetes regularly. I do often, but sometimes because of my busy work schedules nowadays I am not regularly watching it. Alright, I can understand your concern, but the situation is really serious and you should take care of it. Okay. I understand what you said. That's great, so shall I ask you a few questions regarding your lifestyle? Sure. Do you have a habit of smoking? Yes, I do. You know my life is very stressful and smoking relieves my stress to a greater extent. Yes, I really acknowledge your words, but the fact is smoking cannot eliminate any kind of stress from your life. Moreover, smoking habits could lead to many diseases. Yes, you might be right, but I don't really think that I can stop smoking. Yes, I appreciate your trouble, but I strongly recommend you stop smoking, as it can also aggravate your diabetes. Instead of smoking, you can try to adopt some other methods to elevate your stress, such as yoga, meditation, and some small exercises. Okay, I can give it a try. Yes, definitely be determined and try it. Definitely you will be able to stop smoking. Alright. Okay, now let me dress the wound with an antiseptic solution. In addition, I can also provide you with some antibiotics which could help you in faster healing. Your part is to take the medication without missing the dose. Okay. Do you think that I need to make some changes to my dietary pattern? Of course, it's better to avoid sugar content food from your diet. Okay. Moreover, you can add some more vegetables and fruits to your dietary habit. Most importantly, it's very necessary to stay away from smoking. Alright, definitely I will try my best. I am really glad to hear that. So, follow all the medications I prescribed for you, and get back to me next week to further follow up on your wound. Okay, doctor. Thank you. Get well soon. Thank you, doctor.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.